Good afternoon. Welcome and thanks for joining us for today's HIS Talk webinar, The Patient is In but the Doctor is Out, How Metro Health Enabled Informed Decision-Making with Remote Access to PHI. It's brought to you by VMware. I'm Lori from HIS Talk and I'll be moderating. I have a couple of housekeeping items to make you aware of before we start the webinar. Attendee phone lines have been muted to prevent background noise. Please use the GoToWebinar's questions box in the console to submit your questions to our presenter at any time. The presenter will answer your questions during Q&A at the end. You may also use the chat function to send me a message or ask a question about logistics. Today's webinar is being recorded, so you'll receive a link to the recording as well as a PDF version of the PowerPoint presentation in a follow-up email. Our speaker today is Joshua Wilda, who is the VP of IT at Metro Health in Grand Rapids, Michigan. With that, I'll hand it over to you, Josh.
Thank you, Lori. Good afternoon and good morning to those out there, depending on where you're calling from or listening. As Lori stated, my name is Joshua Wilda, the Vice President of IT for Metro Health. I have the pleasure of representing our organization behind what this technology has done for us today. Some housekeeping things that I like to talk about is we do have members from VMware on the phone that will help us answer any questions as we go forward. But today's deep dive is not so much into the technical infrastructure nuts and bolts of that. Metro Health is always welcome to having those conversations and helping out any strategic partners in the future of how this can help them in their organizations drive how this catalyst of change can be there. What we're going to talk about today is how the technology of VDI in an IT space can help drive patient care in the healthcare space and how Metro Health has really leveraged this to really drive our patient care and patient base throughout our community. So Metro Health is located in Grand Rapids, Michigan. We're a 208-bed acute care hospital. We serve the West Michigan base. We have hospital services as well as ambulatory. We are very strong in our ambulatory mode. So when we talk about VDI, we have to deliver that to our ambulatory sites located across the city. We employ about 2,000 employees, 500 physicians here at Metro Health. Our approach at Metro is to be very innovative when it comes to healthcare IT, driving technology, helping the patient get the care they need when they need it. Some of the relevant IT profile information I wanted everyone to be aware of because I think it's key as we go forward when we do talk about the technologies behind the scenes. Through our VDI, we are deploying about 300 applications accessed both right from the desktop or web-based applications. We have two active cross-replicated data centers helping us drive this technology. We have over 3,000 endpoints just within Metro Health bricks and mortar alone where VDI can be accessed anywhere, anytime. Our EMR is Epic. We are on the full enterprise suite of Epic, both ambulatory and the hospital-based. This is always a key one, and we'll talk a little bit about this later. Our VDI for all of the employees, for everyone that we have an outreach for, it's managed by 2 FTEs, as well as some third-party managed services from our infrastructure standpoint. But we'll talk a little bit about that later, about the cost savings here. And then this is also a big one. We do not have any Citrix within our organization whatsoever. All the applications, all the services we provide are sans Citrix. And I think that is also a key. We hear this all the time, is how do people do healthcare IT without the Citrix environment? So Metro Health has a very strong patient-centered base. We are an osteopathic hospital. Our IT department is very patient-centered. So our passion is to lead and support the improvement of the health and well-being of the communities around us and the patient base around us. And this ties heavily into what VDI can do and the mobility of VDI. As some of you may know, healthcare is driven off of what they call the triple aim. Right now, the industry is saying the triple aim +1, and that is to increase the quality of patient care, to increase the patient satisfaction that they're getting, to lower the cost of what healthcare is. And the new one, the +1, is increasing that physician satisfaction. And the reason why I like to bring this up whenever we talk about our VDI is because when you look at VDI and what we're delivering, it meets all of those criteria just by its implementation alone. So when you talk about VDI just based on what it is shared computing resources, right? It is having our end users being able to access a virtual desktop anywhere, anytime. That is a vision of ours. That's a statement that we've always made. is that our VDI deployment needs to be anywhere, anytime. What this drives is definitely cost savings. When I can get to my desktop anywhere, anytime, I'm saving costs by increasing efficiencies, increasing my development with quality, with the patient care, with where we're going. Yes, healthcare is always driven like anyone else from a business standpoint of what's the bottom line. Whenever you talk about this with your CFOs or with other folks, that's where the conversation always ends up going. But you really have to look at VDI from that standpoint of, in healthcare, how is it driving where we're going and how we're delivering care to patients when they can't get to us. It is about how the physicians get to the information and then how the supporting services support those physicians in getting to the information. But you really have to approach it from a patient-centeredness. Where could the patient be when they need the care? And IT needs to be able to deliver the infrastructure so our clinical caregivers can give that care anywhere, anytime. That does equal cost savings across the board from a VDI standpoint. When you talk about infrastructure, of course, I already mentioned, tongue-in-cheek, we do not use Citrix. Many of you might know that Citrix has a lot of infrastructure that's around that. We don't have that overhead. We don't have that cost behind the scenes to be able to drive care. So it is something that's very seamless and something that we always talk about when we go forward. So what I wanted to show you is our timeline of VDI. Metro Health has had some strong roots in the VDI space. Our CIO, Bill Lukowski, has a vision. He's been with us for 20 years, and he's driven this organization to how way out front, delivering healthcare even before the healthcare industry is ready for it. We often say that we were doing meaningful use before there was meaningful use. We often say we were doing mobility before there was mobility. And what this timeline actually shows is back in 2007, we had a very strong catalyst in this organization to really drive change. The first catalyst was we were going to Epic as an EMR. We were one of the first mid to small size hospitals to partner with Epic that Epic would sell to. Many of you might know from an EMR standpoint, Epic sells to the bigger organizations historically. We were one of the first, and we knew we had to drive Epic in an efficient manner. The other catalyst was back in 2003, we began to deploy and to develop a new hospital. We were moving from a landlocked position within the greater Grand Rapids area to the outskirts of the community. What that catalyst allowed us to do is allow us to think about IT differently, kind of start over. Start over from the standpoint of bricks and mortar being bound to a PC. Our CIO, and he drives it to this day, anytime, anywhere. And that equals mobility before mobility was even a word. So as you can see through our timeline, Metro Health has deployed different versions of what we did from a VDI space. Early on, there wasn't anyone out there doing it the way our CIO wanted it to be done and needed it to be done to deliver healthcare. So we internally had to develop some of our own brokers, our own solutions to what was going on from a VDI space. As we move forward, our capacity, our need to get away from personal development and more of driving the strategy of usage and management meant that we needed to find a partner. We needed to find who out there in the industry was also delivering VDI in a space that meets our needs, that was a strong partner to us, that would be willing to work with Metro and the vision that we had for driving patient care using the VDI desktop. VMware was that perfect partner for us, and in 2011, 2012, that's when we started implementing the VMware View product and driving that through our organization. But again, as you see through this timeline, we've kind of ran the gamut of different versions, different spaces that are out there. You can also see we've ran the gamut of now, as we've developed our VDI space, what are those different endpoints that our end users need to be getting to and getting to their VDI desktop from? Again, mobility. The driver wasn't, hey, we needed to get to it from a PC. It was the vision of anytime, anywhere. And you are going to hear me say that over and over and over again, because I think that's a strong mantra when you're delivering the strategy of what a VDI, VMware particularly can do for delivering healthcare. Some hurdles along the way that we had. And when I say they're hurdles, they were great hurdles to overcome. Some of them were self-inflicted. Some of them were because our CIO is always trying to drive us and drive the technology to the edge. We never get to remain stagnant here at Metro Health, especially from an IT perspective. We're always trying to be on that cutting edge. And so some of those hurdles along the way was login times. Traditionally, you sit down at a desktop, you log in, it takes you 3 to 5 minutes to log in. That's 3 to 5 minutes. Our physicians were not delivering patient care. They were waiting for the technology, an intrusive thing to what they were trying to do, delivering care. And so what we wanted to do is make sure that you can get to your desktop as soon as you needed to treat the patient. And that's what was driving our login times. Computing power. As more and more of our EMR and some of our other applications required more compute power, big data coming through, we always needed to drive now what can the desktop do. It's great that you can access it, but if it isn't stable, if it isn't snappy, if you will, you wouldn't be able to get to the information when you needed to. Graphics, as you know, in healthcare, we're always driving the graphics from x-rays to modalities all the way to now telemedicine using graphics from the VDI standpoint. Again, anywhere, anytime. We didn't want you to be bound by, well, you're sitting at a desktop with high graphic resolution monitors, and that's the only place you can deliver care. We wanted you to be able to deliver care from wherever you can get to the desktop using that graphics. Personalization, this was key. I think this was a differentiator when we really started taking a look at what Metro Health's VDI deployment was going to be to our clinical staff. We wanted the physician to feel that when they logged in, they were getting their desktop, not one that they were sharing across the board, one that they can personalize to their own experience when it meant to delivering care to the patient, whether it be their personal settings in the EMR, whether it be driving their personal links to things. We needed to personalize the desktop experience, the application delivery to them. That also transcended down to all the support staff members that also use VDI. VDI is used across the board at Metro Health. So when you talk about a personalization, I have a finance person on the left-hand side who wants his set of applications, and I have a registration clerk on the right-hand side who needs their set of applications. We needed to drive through the virtual desktop a personal experience because that translated to patient satisfaction. If I have a personal experience as the caregiver, I'm going to be transcending that to the patient from a personal perspective. Printing. Some of you might be saying, well, you're on an EMR. Why are you printing? Well, as you know, we can't get away from printing. But we needed to be able to drive printing to be conducive to location-based, to where I am sitting, and having those printers be ready and able to us. And we've been able to develop some things internally that have really made this a non-issue for us. And this last hurdle that we kind of overcome was that not all apps were designed for a virtual experience. Metro drives a lot of our application base to drive on the VDI standpoint. When I talked about Epic earlier, we also drove Epic to being one of the forerunners of making that a standard platform, VMware a standard platform as it is today. Traditionally, they looked at us that we were nuts. You're not doing Citrix. No, we're not going to. That was our first stance. We are going to stick with VMware. So we were able to, with what we were doing from a VDI standpoint, push our vendors to start thinking in such a way that isn't stuck in their old traditional model of how to drive healthcare IT. And that's, I think, a key when you talk about the interrelated strategies within your own organizations is think outside the box. How can I push? How are we limiting ourselves by doing things the way we've always done them? So VDI inherently is mobility. We always talk about, especially in this conversation, it's about the mobile strategy. If you're looking at virtual desktop as, I want this virtual desktop to only be ran at that one location in my organization, you're looking at it incorrectly. You need to be looking at it from a standpoint as, I need to be treating patients. I need to be able to treat patients when they need to be treated. In this day and age, that means accessing their personal information, their health information, working as a team from wherever I'm sitting as a clinician. That means being able to get to my desktop anywhere, anytime. So there are a lot of interrelated strategies to delivering a virtual desktop, but when you really focus on mobility, I would say that it's intrinsic in virtual desktops. And what I've seen in talking with some of my counterparts at other organizations, and even working with VMware, when they go into organizations, the first conversation is, we want to use virtual desktops, but only in this one area, and only lock it down to that one area. And you kind of sit back and you go, that's a very myopic way of looking at it. If you're really treating it from a patient-centered model, that patient isn't always going to be in that one area. that means that the caregivers will never always be in that one area. You need to be able to access the information anywhere, anytime. Our design strategy. So this was interesting as we kind of moved forward. I had made mention earlier that we kind of jokingly say we were doing mobile devices before they were mobile devices. With our VDI strategy, we were doing it before there were tablets and iPhones, and being able to access from that standpoint. So what we were able to do is even in some of the areas where we're said, well, you need to purchase our mobile application to drive mobile access to a clinical information or clinical data or a support services application. We always shake our heads and go, we don't need your mobile application. We can drive a full desktop, albeit the form factor is a little off, but we can drive a full Windows-based desktop running Microsoft-specific applications to an Apple iPhone. Full desktop implementation. And that's a powerful message when you're really talking with someone who's a vendor who has tried to develop a lot of mobile applications to, well, wait a second, I don't need that. I can get to the full desktop when I need to and where to. In the future, and later on in the conversation, you'll see we did not know the power of that. It was actually our clinical base that started calling us and saying, guess where we're accessing our desktop from? And we started thinking, oh my goodness, you know, we almost started thinking myopically of just within the hospital organization as people found different ways to treat patients from their home, from on the road, from on vacation. VDI and VMware View became a very important strategy within our patient delivery model. So again, this is the slide that speaks to anywhere, anytime. I like to focus on this slide. Again, we're talking from a clinical standpoint, but we can never forget those folks that support our clinical base, you know, our people in finance, our people in registration, our people in HIM. They are able to access the information they need to anywhere, anytime to keep delivering patient care to this organization. It's easy to use the example, I am a physician, I am sitting in my office, I am looking at my EMR, I'm looking at the patient, and now I need to go treat the patient. And I walk into the room, I log in my desktop, and within 30 seconds or less, I am at my desktop, right where I left off, right where that patient's information is. There was no login times, no wait times. Where we see even more efficiencies is we'll be in meetings to talk about decisions that need to drive patient care. And in the past, you'd see a lot of inefficiencies. Oh, I left that on my desk. Oh, I left that on my desktop. It's saved on my desktop. I can't show you that spreadsheet I'm speaking to you about. In our organization, there's a ton of efficiencies because they're able to get to the information, the decision makers, when they need it, where they need it, as opposed to being bound by a physical workstation or bricks and mortar. So when you're thinking about the patient-centeredness of it all, it's kind of a cascading effect. You have the patient at the center of it, and you have the caregivers and where they need to deliver the information. And then you have the support services of how are they going to support the caregivers. And then you have the decision makers and how are they getting to their information, their technologies to help drive decisions. And when you think about it, that is mobility. If the patient is going to move throughout our community, we need to be able to move with them. The traditional model of driving healthcare, of asking the patient to come to you, that's out the window, and we're seeing that more and more as healthcare and telemedicine is driven. VDI allows us that vehicle in a simplistic way to be able to give that end user a strategy of here's your full desktop, here's all the information, this is how you can drive that information to treat the patient, and it's all right there at their fingertips. We like to say from the Epic standpoint, you know, again, I am able to collaborate with my colleagues because I can log into my desktop and see all the information that they might be logging into from a standpoint of driving the patient care. That's a very important base. When you think about driving healthcare through the telephone, I'm working with another care team, a consultant, if you will, or a consulting physician, and I'm trying to tell them about a patient's care, and if they are not in the traditional sense, at a PC where they can log in to see that information, that conversation can go one of two ways. Either it's mistranslation of what's going on, you can't see all the information you might be speaking to. With a VDI mobility platform, those consulting physicians working together can log into their own desktops but be seeing the same information from any point, anywhere. When you talk about any device, our CIO, another vision that he had when we established our new organization was, I want within our bricks and mortar 10 to 15 and an end user, whoever they are at a desktop where they can get to their information. And that's what we've designed around. We've designed around the nurse's desktop, the WOW, the laptop. As tablets and iPads and mobile devices came on the scene, it didn't take much for us to integrate with them. We already had the infrastructure of view. It was just pushing the icon and saying log in. There wasn't a lot of configuration we had to do from it. And in fact, when you talk about the tablets and iPads from a mobility standpoint, a lot of our end user base found that before we were even ready to support it. Some of us might be scratching our heads and going, that's, how do we control that security-wise and BYOD and all the policy behind it. But that's a great differentiating technology that's a disruptor, is when an end user calls you and goes, do you know that this is how you're delivering care and I love it? And we're sitting back and going, well, we thought we were doing a great job, but tell us more of how we are doing. And that was a key area, especially when we talk about tablets, iPads, and mobile devices, that we were still thinking myopically of the desktop, 0 clients and PCs. When people are calling us and saying, hey, I'm accessing my VDI on my iPhone, we went, wow, we've got something here. And then the remote access from home. We'll talk a little bit about this later. This does definitely work into a strategy when we talk about work-life balance within the organization of treating patients. So Kettering Health is another organization from VMware that's been a strong VMware VDI partner. And we've always talked about what were our key areas and benefits of delivery from a healthcare model. So how do you measure the transformation of an organization from being PC-based to a virtual desktop-based? It is very hard to measure. We can measure the cost savings behind the scenes from a standpoint of what's the infrastructure versus one or another, or maybe the managed services overhead from that standpoint. What's very hard to measure is the intrinsic value that it brings to you when you're delivering patient care. Our goal is to always make sure that the technology is efficient. What that translates is that we can manage it with a lean, small organization staff. But that also means that it's efficient for the end users, so they aren't going through a lot of hoops to worry about the technology while they're trying to deliver patient care. Their focus is on the patient. And if that technology is being invasive as opposed to being transformative, it can be a very hard thing to sell and to measure when your end user base doesn't want to use the technology. So it is something that you have to think about when you're delivering a mobile strategy using a VDI desktop is the dollars and cents. They are there, but there's a lot more value, intrinsic value, to driving a mobile strategy of getting to your desktop anywhere, anytime to deliver that patient care than just those dollars and cents. We'll go over a couple of examples of things that we were hearing and things that we were driving of those key areas of benefit as we learned and we're on our journey from a VDI standpoint. So our CMIO, Dr. Brad Clegg, is a huge champion of what VDI can do because he is a champion of delivering patient care when they need it and where they need it. And so what you can see here is anecdotally, this was something that an orthopedic surgeon called us on, stating that we have saved him 2 trips from the hospital that week because he was able to log in from home to take a look at the information he needed to take a look at from the electronic medical records to really determine if it was something that was needed from his standpoint of being there physically, or he can treat mobily from his house. Now you can see here it says on his TV, and we can all assume he was accessing it from his smart TV. And if he's being Michigan-based, he was either looking at a Michigan game or a Michigan State game. But what this will tell you is that because this physician didn't have to do a lot of hoops to log into a desktop, see the information, or drive in and, hey, actually if I would have had this all of information, I wouldn't have had to come here. This allows patient care to be delivered in a different model. The patient needed to be looked at now. The patient couldn't wait 20 minutes for the surgeon to just drive in just to assess, just to get to the information to assess. So the patient was in, the doctor was out. We couldn't wait for the doctor to be in as well. This shows you how VDI strategy from any endpoint personal or one delivered from Metro, you can access that desktop and get to the information to drive patient care. I should note that as we've gone through our strategy, you know, it's interesting, especially from a VMware standpoint, we are now getting into the fact that you don't even need a remote client on a desktop to get to your information. We are now saying if you can get to the internet, you can get to your desktop delivered. Yeah, with a less experience, and that's more of the technical specs that we can always address at a later date. But I can get to my desktop. I joke around all the time, is that when I'm picking my own personal laptops or iPad or what have you, I log into my desktop at Best Buy just to see what the experience will be like. Our physicians, our clinicians are doing the same thing. They want to be able to drive patient care from whatever device is suited for them. And we don't want to be bricks and mortar bound. We don't want to be workstation bound. We want to be able to have the 65-year-old physician have a 48-inch TV in front of him to be able to see his information. And we want to have that young physician to have his mobile device in his pocket, his iPad mini in his hand, and his laptop in his trunk, and be able to get to that same desktop through any one of those devices to treat the patients and treat the patient care. Remote access. I talked about this earlier a little bit. When you talk about a VDI standpoint, VDI mobility is intrinsic into VDI. If you look at just the desktop part of VDI, you're looking at it incorrectly. You need to be looking at the virtual nature of being able to get to it anywhere, anytime. Being able to do so also drives other efficiencies. The desktop drives access to the EMR, which also drives the ability for us to meet some of those federal regulations around meaningful use, being able to access information. Now, yes, a lot of other applications have mobile devices and mobile applications to do the same thing. But at our organization, we don't have to worry about how do I deploy that mobile app to that personal cell phone to that end user. And also now I'm starting to have to manage their own personal device to meet the needs. Here I'm able to give them a virtual desktop to get to their EMR, to avoid having to do verbal orders, to avoid having to do some of the medication ordering over the phone that they've done in the past, that can intrinsically increase patient satisfaction and patient value and quality because of errors that happen with telephone readbacks, with errors that might happen with dictated information over the phone. We're able to meet stronger requirements in a quicker way and get those incentive dollars, in this case, from a meaningful use standpoint, just by having that VDI infrastructure alone. It also helped us drive the security of the information. That's one thing you should also think about from the standpoint of, from a security platform, there is no PHI saved on a desktop anywhere. It is all on my virtual desktop that's in my data center that person can't lose. Yeah, they can lose their laptop that they're accessing that information, but because we're driving that VDI experience, that mobile VDI experience, there's nothing saved on a desktop because that person needed to be mobile with a laptop and carry that information with them. That's very powerful value as we've gone forward to kind of go, how do we measure this? Our incentive dollars contribute to how we're measuring this. Recruiting from a VDI standpoint. I just saw a study come out, our CIO sent one on, about the age difference between the medical community today about which EMRs the base is using. I think it had something where our particular EMR, Epic, there's a younger 45 and under base using that than the older communities. Our EMR has been a recruiting value to us when we talk about getting people here because of it now growing within the healthcare space. People are trained in their respective areas, whether it be residents or whether it be nursing students, on particular EMRs when they're going through their programs. And so when we're doing a bunch of recruiting, we talk about not only the EMR, but we talk about the virtual desktop space. Here I can deliver you something that you can start managing yourself as an end user mobile-wise to get that work-life balance. You aren't stuck, again, coming in, working late hours from home. Recruiting, I'll give you an example of my own. My wife is a clinician. There is not a night that I don't see her at least logging in once or twice from home, from the couch, from her iPad, just to check up on her patients. I always sit back and I think that's a powerful message because our clinicians are thinking about their patients through the day. They are worried about their patients. They've had those interactions with them. They care about the patient care that they're delivered. And some of our patients want to keep following the patient wherever they can. And my wife is one of those where she wants to make sure her patients are being taken care of every minute of the day. And so she's logging in, taking a look at that information. We're able to tell that to our end users to say, you don't have to sit in your office 24/7 hitting the refresh button to see what's going on with your patient. You want to log in once or twice at night? That's something that's a benefit to you. You want to finish your patient charts because you want to go to your child's soccer game. Go ahead. You can go home from any device, anywhere. You can get to your information. That is a powerful recruiting message, especially in today's day and age of that work-life balance and delivering that patient care. Speaking of patient care, this is one that I think is tried and true with the virtual desktop experience. And it really is that patient care team and delivering the need of the patient when the patient needs to be there. Patient is ready to be discharged. The physician, the attending physician, might not be in the four walls, might not be in the hospital, might not be in the organization, but we need to discharge this patient. We want the patient to go home. That's our goal, not to keep the patient, but to get the patient on their way as healthy as we can. Well, to do that, at times, the physician isn't always around to be able to say, yes, they're ready to go. So with the VDI experience, one of the examples we're always able to do is to say, this patient's ready to go. Hey, physician, let's log on. Work with the care team that is there to take a look at the information that's ready for that patient to go home. In this particular case, the physician was able to discharge a patient while sitting in his car. That's not unsafe. He wasn't driving. He was in his car, and what I mean by not unsafe, he was able to see the clinical information to make the proper decisions to discharge that patient. It wasn't being told to him over the phone, where there can be errors of translation of what's going on. He was able to see all of the labs that were ordered or needed to be still ordered or waiting to be resulted, the patient care stats of is this patient stable enough to go home, work with the nursing care team that was there on site to discharge this patient, all while sitting in his car at a parking lot. I think that's, again, a powerful message to say the patient needed to be treated. How is our organization treating that patient when the patient needs to be, not when our organization is ready to treat them? And our technology, our VDI technology, enables patient care to be happening when the patient needs it. We talked a little bit about this, the transforming work styles. What some of our younger group really found, younger group of physicians were the ones who started finding, hey, I can access this up on my iPhone. I wouldn't always recommend it, especially if you need glasses, but it is something that can deliver care. This particular cardiologist, while logging in from home, and I always make the joke, he was on a plasma screen TV. Our CMIO, who is a family practice physician, would say, yeah, if he was family practice, it would have just been a 52-inch screen TV, not plasma. But this cardiologist, while working and sitting at home, was thinking about his patients, got a phone call, needed to take a look at doing a read, an echocardiogram, was able to log into his VDI desktop, take a look at those studies. Now, we don't promote diagnostic quality yet. We are getting there. We are driving that with our VMware partners and others to really promote, hey, federal industry from an FDA standpoint, we can be driving diagnostic quality imaging from this kind of solution. But in this case, he didn't need to be that quality. He was able to see the echocardiograms and be able to do a read for his patients when the patients needed that read to be done. And I think that does start changing the way healthcare medicine is practiced. Even when you think about telemedicine as it stands today, you think about it from a standpoint of I need to sit in front of a computer, physical workstation, with a camera to be able to see my patient and doing that telemedicine video visit. With VDI, we want to drive it. No, you really don't need to be in that one room where you do telemedicine. You'll be able to do that telemedicine experience anywhere, anytime, getting to the full desktop experience. You're probably getting tired of me saying that, but it is true. Anywhere, anytime, for wherever I need to see that patient and drive that patient care. And it's transforming the delivery of the patient care. This one was one of the cool ways of saying I need to treat my patients just like I treat my family as a part of them, and I need to be focused on my work lifestyle and where I'm going from that standpoint. In this particular case, you have those young families who they want to be with their families, but they are, you know, our healthcare providers are in it to be with our patients. They're also having their patients on their mind, and they need to be balancing that dichotomy of the family needs them as well as their patients. And this VDI platform drives that. As I mentioned earlier, my wife, while I'll say it, I'll embarrass her, while nursing, is able to log in, our 6-month-old, nursing our 6-month-old, able to log in and see patients at the same time. It's not a demand of this organization to do that. It's an enabler of this organization to do that, and it really drives something that I don't think a lot of our physician base really realize. I think they've come to take advantage of it, but for taking it for granted. We always joke around, what if we took away their VDI for a day? If they went back to the days of, hey, you have to drive in and actually log into a PC, or have to deal with some of the technology hoops of having things delivered via Zen apps or anything else that you might have to do. They're taking the VDI desktop for granted, and it's interesting when we have other physicians and have other industries taking a look at VDI, it's hard for us to understand how they're not using VDI from a mobility efficiency standpoint of how they can deliver the care or deliver the particular service that they're trying to deliver using the VDI platform. And in today's day and age, the work-life balance is so focused, especially from a workplace position, that we in IT are able to sit back and say, hey, I can give you the ability to see your information, and I can give you the ability to be with your family. And for you to decide when you want to do it or need to do it. But the technology is not an inhibitor. It's an enabler in this instance. So how do we measure it? This study that we did with IDC really took a look at the cost savings over time of the efficiencies of, as a physician is using the desktop experience and the efficiencies that it has there, login times, access to information times, that is the time saved spent with a patient. How much time now, the 30 seconds every experience I have logging in that I'm saving of the login, that's 30 seconds more with a patient. And we realized almost $2.7 million per year in benefit of higher revenue and employee time savings of just delivering the VDI platform. What this study doesn't talk about, and again, something hard to measure, is the infrastructure efficiencies, operational efficiencies. With our VDI platform, I can tell you confidently and equivocally, we were able to make the jump from Windows XP to Windows 7 in 15 minutes for our organization. Okay, exaggerating a little bit. We do have PCs that have desktops on them where we had to image those PCs. But in one night, when we were ready to make the switch for all of our end user base, it took us 15 minutes to give them all their desktop. And that was just the time it took for us to click buttons. It had nothing to do with the technology itself. Downtimes, when we do management and maintenance of our EMR, because we're delivering it from a VDI experience, I'm able to do maintenance downtime windows in less than 15 minutes and get the systems back up and running and get them in the hands of our end users to do the patient care. VDI delivers that, and so I always say, you know, $2.75 million is a lot, but I think there's a lot more intrinsic dollars that we are saving in efficiencies that I don't think it's easy to manage and easy to measure. This particular slide, lastly, is kind of an efficiency slide that we like to show of how actually the technology is driving some of the infrastructure efficiencies. Some of you who might use Epic, they talk about response times, and again, they're so focused on when I click this button in Epic, how much time am I saving of load screen times and where you're going. What you see on the left hand of the graph is our last version of our VDI experience, where we are from a response time from an Epic standpoint. What you see is a big dip in that response time, and you want that. You want quicker response times. And in fact, on that particular day, we had Epic call us and say, what did you do? We forgot to include them in the fact that we were upgrading our backend infrastructure to our VDI environment. VDI alone was able to increase the responsiveness of Epic just by the infrastructure and delivery of what it can do itself. around that January date, which you can see is a little blip up. That was our blip to Windows 7 across the board from an organization. But we like to show the slide from a standpoint for those of the technology background of saying a lot of organizations spend time managing workflows from response base, and there's a lot of overhead to it. VDI, what we were delivering through VMware, intrinsically is doing it already. So it's already making us more efficient in what we can do without us having to do a lot of maintenance around that. So some of the things that we'd like to talk about is definitely that work-life balance, that consumer-like experience, that personal experience, that technology that helps and not hinders collaboration. When we talk about the patient-centeredness, driving patient care where they need it, when they need it, and having our patient care delivery being done anytime, anywhere, whenever it needs to be. Our system is always on, 24/7, 365. I can again tell you with a very high confidence, and I'll knock on wood, I hope I don't jinx us, we have had very minimal downtimes here in our organization at all, and a lot of that has to do with our infrastructure and what's driving from a VMware standpoint. We're able to give those desktops to our end users to drive their need of patient care. And I think that's always key when you're talking about healthcare IT, is looking at it from the standpoint of we all need to be healthcare professionals in the IT space, understanding how IT can drive healthcare. If it is all about the IT, I would argue you're in it for the wrong reason from a healthcare perspective. We have to look at it as how can IT help drive healthcare, help drive patient care, and make that more an efficient model. VDI, VMware, does that. It drives our workforce base to think differently when it comes to patient care. It enables them to think differently. It enables them to be in such a way that the technology isn't just isn't in the way. They aren't bound by bricks and mortar. They aren't bound by a physical workstation they always need to go to. With our VDI and VMware, they're able to get to things when they need to and where they need to. IT is able to deploy it where they need to, when they need it. And when they need it is when the patient needs it, and that's always our focus. So with that, I will open it up for questions.
Thanks, Josh. Now, as he said, we'd like to open it up to the audience for questions. As a reminder, please use the questions section on the GoToWebinar panel to submit your questions. The first one, Mike would like to know, which physicians have remote access?
All physicians have remote access. And that, I should clarify that when you talk about remote access, that's accessing the information desktop VDI standpoint. We being community-based hospital, we have a lot of competition in our market for independent physician access and independent physicians. We are more of one of those organizations that are really driven on being a differentiator in the market as a choice in the market. We have not gone down the road of buying up a lot of independent offices. We're more of the private, very partnered standpoint with our independent offices. So when you say all physicians, not only are physicians that really just do patient care for Metro Health, we are able through VDI for a desktop to some of the independent physicians who also need to collaborate when they need to, where they need to, based on the partnerships. So that also allows us some strategic value within our community of how can Metro Health increase its patient base by increasing the amount of physicians that are collaborating with us and having IT being an enabler to do that.
Thanks. Can you talk about whether there have been any issues with adoption?
You know, that's an interesting question because I think you really have to take a look at, and I was talking to my counterpart, Ivers Absite from VMware today about this. You really have to look for the catalyst that drives that need for it. Now, Metro Health had a perfect case for it, as I spoke to earlier. The EMR and the move to the new hospital, it wasn't a choice. The adoption was going to be there. I know that a lot of people talk about, well, I got my Citrix environment, I can't get away from that because that's what they're used to. I think what you need to do is have a strong champion, not physician champion, clinician champion, not so much from this is what IT does, but how this is enabling different patient care and driving that message to the organization. And what you'll start seeing from an adoption rate standpoint is you start seeing a lot more of the departments driving from that standpoint. They see one department taking advantage of it, and they start taking advantage of it from a mobility standpoint. Couple of the departments that is still slow to the boat had been like our finance areas, where they feel they need very strong computing power. I need my PC. We hear that all the time. It's kind of interesting. And so what we try to do is really partner with them. VDI allows that. We're able to say, hey, try your desktop for 5 days. We can pull it back if you don't want it. We give them the ability to use the desktop and see how it would work for them. So then we can come back and drive how else it would be needed. Adoption wasn't too hard because they weren't waiting to log into the desktops. That was one thing, a wow factor right up front. We were able to show, hey, that 3 minutes, now it's 30 seconds from a cold boot to a desktop. And now when I'm disconnecting and logging in from another endpoint, I'm logged in within 3 seconds right where I left off. That's a powerful message. Now it's hard to say it, you need to show it. And I think that's key, is being able to show it and getting their hands on it. And we had to work with VMware a lot in the latter stages about how do we even show that more to our end user base of what the technology can drive. So adoption will be there. I think you always need you can tie it to a catalyst, but you always have to have that message and that alignment message behind it. And if you just treat it from a standpoint of this is cool technology, you're not going to get it. You need to make sure you know the business that you're talking to. And in healthcare, you're talking to many different businesses, clinicians, finance, HR. If your IT department is strong enough, say, to HR department, this is how this will make you efficient. This is how you can utilize this to make your life better. That's powerful, and that's always key. You need to be able to know your business, and I feel we do that well at Metro.
Thanks. Next question, what training do you find necessary for the doctors?
If you're talking from a VDI standpoint, the training is click a button and put in your AD credentials, and you got your desktop. That's the training. Obviously, with the applications, we do a lot more training from that standpoint. But when we have a new user enter our organization, they are deployed a VDI desktop that they can access anytime, anywhere. We have on our website externally, if they want to download the client to remote access from home, they can download the client from there. VMware, for some of you that may not be familiar with them particularly, also have a product, I believe it's still called Blast, where if you have a URL, you can get to your desktop. And so that's where I said earlier, wherever the internet is, you can get to it. So really, it's just as easy as click a few buttons, log in using your AD credentials, and you're in. So training is very minimal from the VDI platform.
Great, thank you. Last question, what kind of devices do you find the doctors want to use?
That's a funny question. All of them. They want to use all of them. And I kind of spoke to that a little bit earlier too when I talk about jokingly saying going to Best Buy. We actually talk about doing that right now, using VDI and what you're seeing now with the 2-in-1s, stylists, those sort of things. That technology is coming out. And here's another value. I'm always making that plug. In the past, if we wanted to do a device fair, I would have had to have purchased a handful of those devices and have them here in-house as an asset for people to try. Whether they ever use it or not, it's irrelevant. We would have had to incur that cost. I jokingly around with our physician IT work group and saying, one afternoon we're going to go to Best Buy and we're just going to log into our desktops from their desktop. Because they have the internet access, I can log in with my AD credentials to do that. So we aren't really bound by the technology itself. What we are bound by is us trying to manage the BYOD and some of the security and privacy and two-factor authentication cases that might have to be when they want to bring it in our four walls. And they're calling, asking for help with their devices. But from the standpoint of what do they want to use, they want to use it all. And that is our goal, is to allow them to do so.
Thank you. As I said, that was our last question. So at this point, we'll conclude the webinar. I want to thank attendees for joining us today, and thank you, Josh, for a really interesting and informative presentation. As a reminder to attendees, watch your email for links to the recording of today's webinar as well as a PDF version of the PowerPoint presentation. We look forward to seeing you at our next HIS Talk webinar. Enjoy the rest of your day.